Hello friends, myself doctor and dietitian Riddhi Majithia, and today I'll be explaining the topic which is complications of pregnancy and how can we manage those complications for better outcome of pregnancy. So complications basically include the most common complication that any and every pregnant women faces is the nausea and vomiting. And nausea and vomiting generally been termed as morning sickness because it generally tend to happen in the early morning timings, and also it happens in a first pregnancy of any women, and during the first trimester of pregnancy. Basically it starts at 1 to 1.5 months, which is like 4 to 6 weeks of pregnancy, and it stays till the 14 to 16th weeks, which is 3 to 3.5 to 4 months of pregnancy. And morning sickness can be prevented by basically it happens due to, first of all, why it happens. So basically this happens due to the hormonal imbalance, like progesterone and estrogen hormones are increased during this phase of time, because the woman is start developing baby in the womb. Also because the anxieties that firstly pregnant women has, so that can also cause this nausea and vomiting early in the pregnancy, which is specifically early in the morning. And it can be treated by taking high carbohydrate or rich food, specifically toast or biscuits early in the morning. And women can try having small frequent meals instead of taking large meals. Complex carbohydrate can be taken. Simple carbohydrates like sugar and things like that can even help. And also taking small frequent meals and walking after meals, not taking waters during meals, and taking water in between meals, and also fluid and electrolyte balance in case of severe dehydration is recommended. Taking fruit juices and light meals will be very helpful, and taking walk after meal will certainly help. The second complication during pregnancy is constipation. Now, the constipations mainly occurs due to the placenta and the womb is the uterus is expanding in size, which exert pressure on the stomach and small intestine. So peristaltic movement of the intestine is gradually decreases due to the hormone produced by placenta, as well as uterus exert pressure on the on the small intestine. So basically what happens, due to the decrease in the peristaltic moment, the small intestine has to work extra pressure to create these elimination habits. So it also the reason. And constipation can be treated by taking high fiber food, complex carbohydrates, and fruit juices. Increasing water intake and fluid intake can also be helpful for constipation. The third complication, friends, we face is heartburn. So this heartburn is not due to the any heart patient doesn't have any heart issues or specific acidity, but it is just happened due to the extra pressure that is created by small intestine and stomach, uterus on the stomach and small intestine. So the size of stomach is decreased. The capacity of stomach is, if it is 50 ml, it decreases to 20 to 30 ml. So basically when a woman eat large meal of food, the gastric juice and the food mixture gets up in the lower part of the gastric pipe, and the food comes upside. And also the pressure created by uterus on veins, vena cavas, exert pressure, and the heartburn happens. And it can be treated by taking small frequent meals instead of taking large meals. Walk after meal, increasing fluid intake, and not directly lying down after meals. A woman has to keep and working and keep herself busy to avoid such a complications, and eating small meals will really be helpful. The fourth complication that women faces is toxemia or pregnancy hypertension. It has two types. The first type is primary hypertension, which happens to some of the women during the second part of pregnancy, and it is treated by salt restriction, and it includes also albumin in urine, which can be treatable, and the blood pressure that increases is between 140 to 90 mm of Hg, which is normal. We consider it acceptable or in a normal range, which happens during pregnancy. But the secondary type of hypertension, which is increasing in the with the range of 160 to 100 mm of Hg, which is the area of concern. A woman needs to take physician consent for that. Certain medications or the excessive salt restrictions, food restrictions, fried or salty or highly sugar or seasoned rich foods should be avoided. And this condition is excessive hypertensive condition is termed as preeclampsia, and this preeclampsia can be converting to eclampsia, which is coma and convulsion at the larger part of later part of pregnancy, which can induce mortality in pregnant woman or child birth. Cannot or mortality rates are increasing of woman or the child just because of this pregnancy hypertension or toxemia. So it is area of concern specifically, but salt restrictions, diet changes and exercise can help. And the fifth complication that happens during pregnancy is anemia. So anemia is basically happens due to the already woman has increased the blood volume by 50%. वुमेन का ब्लड वॉल्यूम 50% बढ़ जाता है, ब्लड लेवल्स आर इंक्रीज्ड. So what happens is the blood cells increases. So increased blood cell require extra amount of hemoglobin, which is iron, folic acid demands increases definitely. But if it doesn't recovered by the already existing storage. अगर woman pregnant होती है तो उसके पहले उसके अंदर before conceiving there has to be some amount of folic acid and iron storage has to be there. Then woman doesn't have to run out of her own storage to give it to the baby, and this condition can be treated. And for that, fortified salt intake with iron is recommended. Also vitamin B, folic acid and supplements like vitamin C are recommended during pregnancy, and it can be treated very easily. So even if anyone is planning to conceive, they should start taking folic acid and multivitamin tablets, which is recommended. We often tend to give that to the pregnant women. So the sixth and major complications that happen during pregnancy is also the gestational diabetes. Women's with the history of diabetes or in their family, hereditary diabetes or obese women are more prone to gestational diabetes. In this period, women are having excessive hormone progesterone production or the hormone production by placenta, which decreases the level of insulin, which regulate the blood sugar levels. So when placental hormone decreases the level of insulin, so when the woman eat high carbohydrate or sugar rich food, it cannot be controlled by insulin because insulin level is already less, so that can raise the blood sugar levels. And to control this, woman should restrict her food intake, like highly seasoned rich foods or sugary fruits or foods should be in control. And if the diabetes ranges even higher, then there can be it can be restricted by insulin therapy or a physician consult, gynec consult has to be taken for this. So these are the basic complications. One more complications that we cannot miss out is edema. Pregnant women face edema in ankle or feet, or like hand, chin or face. But basic edema that happens is due to fluid accumulation, excessive fluid accumulation in the body due to extra salt intake. So when the fluid intake is on a excessive fluid volume increases during pregnancy. So if the fluid intake and salt intake is in restriction, then it can be pretty easily manageable. But when it comes to having edema on or stomach, on hands, on face, larger part of face or neck edema happens, then it is an area of concern for pregnant women. And fluid restriction, diuretics treatment. Diuretics are basically the medicines that remove fluids from the body, and also exercises and salt restrictions are advised to balance the edema. And it happens in second and third trimester in the pregnancy, so it can be easily treated with the salt restriction and food restrictions, which we definitely give in the form of nutrition and dietetics in women's. I hope you understand it. If you don't understand anything, please ask me in detail. Thank you so much.